Have you ever had a sudden nosebleed and wondered why it happens? Today, we're talking about epistaxis, the medical term for nosebleeds, and how to handle them safely. What is epistaxis? Epistaxis is bleeding from the nose. The inside of your nose is full of tiny blood vessels, especially in the front part called Kieselbach's plexus. Because these vessels are so close to the surface, even minor trauma, dryness, or irritation can cause bleeding. Types of nosebleeds. There are two main types of nosebleeds. 1. Anterior nosebleeds, the most common, usually from the front of the nose. Easy to control at home. 2. Posterior nosebleeds, less common but more serious, coming from deeper vessels. They often require medical attention. Causes of nosebleed. Nosebleeds can happen for several reasons: dry air or low humidity, nose picking or trauma, allergies and infections, blood-thinning medications or anticoagulants, high blood pressure or bleeding disorders. Most of the time, nosebleeds are harmless, but recurrent or heavy bleeding should be checked by a doctor. How to stop a nosebleed. If you get a nosebleed, here's what to do: sit upright and lean forward. This prevents blood from going down your throat. Pinch the soft part of your nose, just below the bridge, for 10 to 15 minutes without letting go. Apply a cold compress to your nose or cheeks to help constrict blood vessels. Avoid tilting your head back or lying down. If bleeding lasts more than 20 minutes, is very heavy, or follows an injury, seek medical care immediately. Preventing nosebleeds is easier than you think. Use a humidifier in dry environments. Apply saline nasal sprays to keep nostrils moist. Avoid picking your nose or blowing too hard. Manage allergies and treat colds promptly. Epistaxis may be scary, but with the right steps, most nosebleeds are easy to manage at home. Remember, persistent or severe bleeding is a medical emergency. If you found this video helpful, like, subscribe, and share to help others learn how to handle nosebleeds safely.